and frankly, also just feeling, supported in your treatment. And so it was actually this frustration of not getting care that led me to start Allara, and really build, frankly, the care that I had always wanted. I always was looking for care that felt more holistic. I think that was something also that I found really frustrating, was it felt like, you either can go to the doctor and they'll say like, take birth control and that's all I got for you.
Welcome back to the PCOS Holistic Coach podcast with me, Dr. Ami Patel, pharmacist, fellow sister, and coach. This podcast is an easy to listen to resource for your busy on the go life. You will learn how you can live a healthier and happier life with PCOS from real conversations about managing PCOS and the symptoms with amazing guest speakers. Welcome back to my channel. Today I'm excited to have a special guest here, Rachel Blank. Rachel is the founder of Allara, a digital health platform that provides better medical care for women with chronic conditions like PCOS. Rachel earned her MBA from Harvard Business School. Prior to founding Allara, Rachel was the director of strategy at Rory, where she launched her Near Women's Health brand. Thank you for being here, Rachel.
Thank you for having me. It's so exciting to be here.
I'm so excited about our conversation. So let's jump right into it. Tell us a little bit about when and how you were diagnosed with your PCOS.
Yeah, so I was diagnosed with PCOS about 10 years ago, in my early 20s. And actually, it was like kind of a total fluke diagnosis. I had had undiagnosed stomach issues for years. And so I was going from doctor to doctor to try and figure out my stomach issues, which, we actually often see a lot of overlap between things like IBS and PCOS. So I was doing like every test under the sun to try and figure out my stomach. And ended up getting an ultrasound. And in the ultrasound tech said, "Did you know that you have PCOS?" And I said, "What are you talking about? Like, I don't even know what that is." And she said, "Well, your ovaries are covered in cysts. So like I'm pretty sure you have it." So I was diagnosed actually by an ultrasound tech in discovering stomach issues. And I was like, okay, so I guess it makes sense then why I only got my period once a year for the past 4 years. Like I always just thought it was like this funny thing that I never got my period. And in hindsight, when I like found out that information, I started to put, a lot more of the puzzle pieces together that I really had never thought of before. And I think, what to me is actually the craziest part of the story is my dad is a gynecologist. He's a gynecologist in DC. So I have access to the best, of medical care that I want to see. In theory, like I could have gotten any question answered. I just didn't even know to ask the questions. And so I think, it's so wild to me that I even fell into that statistic of like having these symptoms, not getting them diagnosed, having this kind of crazy fluke diagnosis. And then, when really in reality, like if I can't get good care, if I can't get an easy diagnosis, like who could,
That's such a valid point. And I think like first of all, it's crazy like the ultrasound tech so that's really amazing. And it's crazy because I think like our society we don't talk about things like periods enough, right? Like I don't know, like I don't know if you talk to your dad about this or you kind of just thought, oh, it's not a big deal. Like I don't want to like you're probably like a teenager, right? Like early 20s.
Exactly. Yeah. Like who wants to talk about their period? I also remember being like super ashamed because I felt so unlike my friends, right? I was like, I got my period late and then it was so abnormal and they would all talk about getting their period every month. And I'd be like, oh, haha, like I don't get it. And so I think there was also just kind of this culture of like me feeling ashamed and different that also kept me from talking about it. And again, I think that's why it's so important that we all share our stories like you have, like I have, because these things are so common, we just can feel like they're not, and we can feel very isolated.
Yeah, I agree. And I think even like I know sometimes when you do tell people that you don't get your period, people say things like, "Oh, you're so lucky," like that's a good thing. I think that's kind of like the misconception about periods that it's supposed to be painful, so it's good that you don't get it. And so I think that probably is something. Oh well, people are telling me that I'm lucky I don't get my period, but maybe I don't need my period after all.
Yeah.
So
Yeah, we all should talk about periods much more.
yeah, I definitely agree. I'm glad we're having this conversation and the things we're doing as well. What struggles did you face in managing your PCOS symptoms after you got your diagnosis?
Yeah. I I mean, that to me is still, I think that's what's so wild is most conditions, like that's the hard part, right? Is getting the diagnosis. And then there's a medicine you can take there, is a clear set of guidelines of treatments. And with PCOS, as so many women know, that's just not the case. The diagnosis is just the start of this like very long journey. And so, I really felt like actually for years, I never really got that much care around it. I was put on birth control and that was kind of it. I went to a bunch of different doctors. I actually had this really frustrating experience where I have lean to take PCOS. So I actually have been diagnosed multiple times now because I've had multiple doctors say, well, you don't look like you have PCOS. Like, I don't think you have PCOS. Maybe you just like don't eat enough and that's why you don't get your period. And I've had like multiple ultrasounds at this point, all of which will tell you like I have PCOS. And so I actually find it really frustrating, just even in like, I found I had to do so much self-advocating for myself every time I'd go to the doctor and say like, can you just take me seriously? I know my body and I know what I have and like, I'm not an idiot. And so like, there should be something better. And, that actually was the reason that I started Allara, was because for 10 years, I felt like I never really had good care. I just kind of got, this like Band-Aid solution of birth control, and that was kind of it. And birth control is great. I still take it. I love it, but there's so much more that you can be doing. Whether that's thinking about like your diet, your exercise, like other supplements, and frankly, also just feeling, supported in your treatment. And so it was actually this frustration of not getting care that led me to start Allara, and really build, frankly, the care that I had always wanted. I'd always was looking for care that felt more holistic. I think that was something also that I found really frustrating, was it felt like, you either can go to the doctor and they'll say like, take birth control and that's all I got for you. Or you can go on the internet and look at influencers who will tell you like, don't touch birth control, don't look at birth control, like medicines are evil, doctors are evil. And in reality, there's like this middle ground where actually, why can't we take the best of both worlds, and think about, what's the best that we can learn from the doctor medical science piece, and what's the best that we can take from like the holistic diet nutrition approach, and why can't those all work together, and why can't there be this like collaborative approach to that? And so that's the model that we take with Allara, is we pair patients both with a doctor and with a nutritionist. So they're getting kind of, this best of both worlds approach, and using everything science has to offer us across different modalities of care.
That's amazing. I love how you said that, you combine medicine and holistic care. And I definitely agree with that. And that's the approach I have with my clients too. There's definitely a time and place for medicine, and it can definitely be helpful. But like you said, there's a way that we can utilize both to get the maximum benefits for us. It doesn't have to be this one way or the other. And that's amazing that you told your story and your struggles, and you're using that to make a difference in serving Allara. So that's really awesome.
Thank you.
What does Allara stand for? Does it mean anything, or?
Yeah, so it's like it's supposed to be kind of similar to like Allura in Italian. It's kind of like hey, like welcome. It's kind of like like very chatty, and kind of a nod to the sense of like we're building this very welcoming community. So we kind of made it up, but it was just meant to invoke this like sense of welcome and friendliness that we wanted to build with our community and our patients.
Nice, that's awesome. That's nice. And that's so important with the PCOS community, and based on the experiences me, and many of the other women have had about, like you said, doctors telling you don't know what you're talking about, you don't look like you have this, and all you really want is someone to support and understand you and welcome you. So that's so awesome.
Thank you.
What were some of the challenges you faced in, starting Allara, and what was your motivation to keep going?
Yeah, I mean, the challenges are still ongoing. There are still many. So, I think for me, I just had kind of this moment of realization, like, all right, things need to change. Like the fact that I started the business in 2020. So the fact that it is 2020 and still I am like turning to Reddit for healthcare answers on a very common condition is just unacceptable. So I had this moment of realization of like, all right, number one, things need to change. Number two, like, wait a second, I, grew up around women's health. My dad's a gynecologist. I have PCOS, so I understand the patient journey. And I had been working in digital health for the past 2 years, launching new, digital health solutions. And so I kind of had this aha moment of like, wait a second, things need to change, but like, I am actually one of the few people who can actually change it. And so it's kind of this like moment where I was like, wow, I feel like this is almost what my whole life has been leading up to, has been this realization that like this truly is my mission in life. I was put on this earth to help improve women's healthcare and help improve outcomes, not just for myself, but for the millions of women out there like me. And I think what I get so excited about when I interact with other women in the PCOS community is like how much of badasses we all are. Like, look at yourself, right? Like, I think there's so many incredible women who have been through this terrible experience, who have been frustrated. And instead of just like giving up, they've said, well, how can I make things better for everybody? And how can I really like use this as fuel and as fire to advocate and to build awareness and to build better solutions? And so I just always get excited connecting with other women in the community and seeing like, wow, like we have so many badasses in this PCOS community really fighting for each other. And, I think for me, it's been really interesting building the business because you have all it's a, venture backed startup. And so already, I'm a female founder. Only 2% of all venture funding goes to female founders too, which is crazy. Then layer on top of that, I'm raising for women's healthcare with like male VCs who don't understand, God forbid you say the word period in front of them. And so it's been this very interesting experience of like being a female founder, raising for women's healthcare, and really trying to, make people understand who have no way of experiencing this, like why it's important and why it matters.
Wow, that's so amazing. Yeah. I mean, we met from PCOS advocacy day because, like you said, we're both advocating, and that's just, that's amazing. You've been through a lot of challenges, you've overcome a lot of challenges, you've used your experience, and it's amazing that you found this mission and you're helping change the PCOS world. So tell us a little bit more about Allara and what offers. Is it available to everyone? If viewers or listeners want to have some of the services, what is like the stuff?
Yeah. So I think as I mentioned, like in a lot of ways, Allara is really just what I had always dreamed of having as a patient with PCOS. And so our approach to Allara is very collaborative, evidence-based, and also ongoing care for patients. Currently, we have a treatment program for PCOS. So the way it works is we will pair you with a doctor. So they are, running extensive labs, looking at everything, not just your hormones, but everything from, do you have high cholesterol levels? Are you insulin resistant? And are you pre-diabetic? Because that's the thing we worry about in PCOS patients. Do you have vitamin deficiencies that could be contributing to your symptoms? Do you have inflammation levels? So we're really looking at this like very, very well-rounded, set of data that to really get to the bottom of what is going on with you. You have a 30-minute video visit with your doctor when you first start, unlike, that 10-minute in and out visit in the traditional health setting. And then you're following up with that doctor every 2 to 3 months. They'll prescribe medication if you need it and if you want it. And they're really kind of this ongoing care base for you. And then similarly, we pair patients with a registered dietitian. So that dietitian is looking at all of that data from the doctor. They're looking at all of that extensive lab work. Actually, the dietitians and the doctors collaborated on what they want the doctors to order, since we know dietitians can't order labs themselves. And then the dietitian is, based off your specific goals, helping think through, what is a good approach for you. So if your goals are, weight management or avoiding diabetes or getting pregnant, like they'll structure your diet plan accordingly. And then behind the scenes, the doctor and the nutritionist are actually collaborating together on care. So they're talking through things like, all right, this patient didn't tolerate metformin, let's try a supplement for her and let's see how that works. And it's really this like much more collaborative care approach. That full program is live in 17 states. So we're in all the big states. We're working on getting nationwide coverage. In some of the states where we don't have doctors, we have nutrition only programming. So you can meet just with the nutritionist. And then we also, knowing how many women struggle to get a diagnosis, we also launched a diagnostic offering. So with that, if you're experiencing hormonal symptoms, you're not sure what's going on, we will order you, again, that very extensive lab work, and then you'll have 30 minutes with a doctor to review it, see, is it PCOS? Could it be something else? And then they'll help talk you through next steps of where to go next.
It's a lot of options. Even if you can't see the doctor in your state, you can at least see a nutritionist or dietitian that you said, and then or you can do the just if you're still unsure or if you're getting
at the end of the day, we want to make sure we're addressing a whole variety of care needs and also making things really personalized to the patient and to what they need. So really just trying to give like a lot of different flavors out there, and making sure everybody feels supported. And even if you can't sign up for the program, we have a ton of educational content on our blog. We have a private community where you can connect with other women with PCOS. So we try to make it, as accessible as possible for everybody.
So, what's like the website, or where can they find some information in the app, or?
Yes. So our website is allarahealth.com. That's ALLARA health.com. We also are super active on Instagram and TikTok at Allara Health. We post a lot of really educational content there as well. And if anybody wants to reach out to me, my email is Rachel, RACHEL at allarahealth.com. I always just like love connecting with people and seeing how I can help. So also want to make that available.
Thank you for sharing that. I'll include everything in the show notes. I had one more question for you. From your experience and journey, are there any words of wisdom that you can offer to our viewers and listeners who are struggling with their own PCOS themselves?
Yeah. There's this quote that I love that I don't know how directly applicable it is, but it's really guided a lot in my life. And it basically is like, what if I fall? Oh, but what if you fly? And it's kind of this concept of like, taking a leap and maybe things will turn out better than you think. And I think, again, what inspires me so much is seeing how many women have gone through so much pain, whether that's being, frustrated and ignored for years, whether that's going through miscarriages and infertility struggles, and have been able to really turn that pain into so much of a mission and so much joy for others. And so I just like, I think like no matter what you're going through, I would actually just keep in mind that like what you're going through is actually probably inspiration to somebody else. And you never know what kind of an impact that you can have, whether it's one person, 10 people, 100 people, like just by sharing your story and being vulnerable with them. And so that's kind of like what I've grown to appreciate about my journey and have grown to appreciate about so many other women. And I would just love to see us like continue to support each other, because at the end of the day, that's where I found the most joy and support. It's been just through this PCOS community.
I agree with that 100%. Like, saying to you, I was struggling on my own. I didn't have anyone to talk to, anyone that understood. And then when I opened up about it on Instagram and YouTube at first, that's when I started connecting with people, and they were just like, oh, I'm so happy that you told me that. I think I have it too. And I'm like, oh, wow. And then, I met you through this PCOS community and advocacy, and so just really amazing journey. And it's so amazing to see, like we said, all of us coming together and forming this strong community to make a difference now. Because we have to help each other right now. And while healthcare is working to get on board with what they need to do to help us, and so resources now, like Allara to help us.
Yeah.
And was there anything else you wanted to talk about or mention?
No, again, I would just encourage, anybody who is struggling with any questions, even if you're unsure if it's PCOS or not, there's so many more resources out there for you now. So if I can be helpful, if Allara can be helpful, feel free to reach out to us. But I so enjoyed this conversation. Like I said, I'm so inspired by you and everything you're doing, and really appreciate the chance to connect.
Yeah, thank you. Thank you so much for taking the time to be here, tell us your story. Thank you for everything you're doing to raise awareness and advocate for PCOS. We definitely need more of that. I love our collaboration, and I hope we can continue to do more in the future.
Yes, likewise.
All right, viewers and listeners, as always, be kind to yourself, be patient, and focus on progress, not perfection. I'll see you next time.
If you loved this conversation, please leave a review and share it with a friend. I would love to connect with you. You can find me on Instagram and TikTok at pcos.holistic.coach. Send me a DM and say hey. Be sure to tune in to the podcast next time. Thank you.